All right, our morning segment with Athens Limestone Hospital, and with me, of course, is Dr. William Thomas. Now, you have a long title here, Athens Limestone Hospital, Cardiopulmonary Rehabilitation. I don't have a clue what that is. You just almost diagnosed me just a minute ago. What were you going to say?
That's right. Well, cardiopulmonary rehab is for people with lung disease, and they're short of breath with exertion, and it helps them build their exercise capacity.
Okay.
That's what it's for.
So with the world of asthma or obesity possibly, do you see a lot of shortness in breath? Is that a candidate possible client or
Yes,
patient?
a lot of our patients have COPD, which is chronic obstructive pulmonary disease, and they have...
You said I had that. What is that?
Yeah, well, it's folks with either emphysema or chronic asthma or chronic bronchitis, and they're short of breath with exertion. Usually the program is for folks with moderate to severe disease, and it helps them build their exercise capacity.
How do people get involved in finding out more about your program?
Well, they can call the hospital, and the hospital can help you set up, or you can talk to your primary care doctor, and they can make a referral. They can come see me or one of the other local pulmonologists. That's a lung doctor, and we can help you get set up for it.
What is the biggest misconception of a patient that you see that really has this but they haven't really known it yet?
A lot of people are short of breath, and it's been coming on for a lot of years, and so they don't really pay attention to it because it comes on so gradually, and they might say, you know, when I walk up a flight of stairs, I just can't make it without getting short of breath. Or I'm trying to walk around at Walmart and push my cart around, I'm having to stop halfway, and these are folks that may benefit.
They probably would. And not just people that are going to blame it on maybe I smoke, so put the cigarettes down and everything's fine.
That's good. Put the cigarettes down. That's always the best thing
anyway.
to do. But, you know, sometimes when you put the cigarettes down, there's already some damage there of the lungs. And a lot of times the medications are not effective. A lot of people don't want to take a medication. They'd rather have something that's non-medicine, and a good rehab program can be helpful.
How much does diet play into something that you see in your patients?
Well, diet plays a part if you're eating too much and you're a little bit overweight.
I'd like to do that.
So it's always good to not weigh as much, but usually diet is important just for overall health, but not necessarily for pulmonary disease.
You know, Jamie read a newspaper article not too long ago with the decline in smoking, believe it or not. There are less children getting the tubes in their ears or asthma. Do you see that here in this area?
We see a lot of asthma in this area. This is an area that has a lot of allergens, and the Indians, I think, noticed that they call it the Valley of the Sick Head, I believe it was, and there's a lot of allergies in the area. If you smoke around your children, yes, they're going to have more allergies, more asthma. I would really recommend not doing that.
If you can at all, that's probably the best tip right now, other than if you need to see Dr. Thomas, definitely do. And put those cigarettes down, and if you're smoking around your children, stop it. That's a pet peeve. When we're driving down the road and you see children in a vehicle and the windows are all up, how do you control yourself when you see that? I know you've had to see that. Because you know how damaging that is for kids. I know it's terrible, but just don't do it.
Well,
don't do it.
You don't do it. You've got a captive audience there. Give your kids a break, please. And give yourself a break. Don't smoke. If you're short of breath, you can't walk, you know,
it's major.
100 feet. If you can't walk up a flight of stairs, you may have moderate or severe lung disease. You need to have that checked out. It may be your heart also, so that would need to be checked. So just be healthy.
All right. You can call Athens Limestone Hospital to speak more about this topic or make an appointment. Thank you so much.
You're welcome. Thank you.
Good to see you. All right. We'll see you next time with Athens Limestone Hospital.